telemedicine is the opportunity to do a real-time audio-visual patient contact through a secure portal through the internet from a distant site, which may be around the world or 100 miles away, right to the specialty clinician's office here at Altru. The technology these days in telemedicine services is very easy. It's much like working the remote control for your television. We have the opportunity to manipulate the camera at the provider end and also at the patient end. So if the provider needs to zoom in and look at the wound or look at the mole, they can do that. Or they can ask the telemedicine nurse on the other end to facilitate that encounter any way that they need to. It's very private, just like a patient interaction. The door is closed. It's just them and the provider, you know, the doctor here at Altru, and anybody else that they wish to have involved, of course. But it's just like a patient encounter that they would have if they came here to town.
Chronic wound clinic's the area where we've been using telemedicine. Well, telemedicine really is basically doing care over a computer or a TV set. And with that, we're able to take care of patients 100 miles away without the patient having to travel. And usually in our situation, this will mean 2 or 3 people traveling. So it's just a huge benefit.
Telemedicine is currently an expanding tool that we use in neurology. We use it to supplement patients that we see in the office. For instance, if we need to make a medication adjustment in a patient with Parkinson's disease, it's important to see that patient soon to see how they responded to that medication change. Well, that's just sometimes not very workable in a patient who lives 2.5 hours away. And for patients that frequently need to bring family members with, if we're talking about multiple appointments per month, we're talking about a full day for both the patient's family to get back and forth between Grand Forks. So it really supplements the office visit, and hopefully it makes it easier for patients to be seen by their physicians to determine effective medication changes on a more frequent basis.
Well, the first encounter I had with telemed was actually kind of necessitated by poor weather up in Roseville, which was actually a godsend because we had a very busy day that day scheduled. Because of bad weather, we couldn't get up there. So we were able to see a good percentage of those patients via telemed, and it actually worked out very well.
During the first few interactions I've had with patients over telemedicine, I like to ask them at the end, how did this go? What do you think of telemedicine? And overwhelmingly, the response has been positive.
The benefit to the patient is that they have been seen by their own doctor, but at the same time, in that community, they're connecting to our specialty care, in this case chronic wound care, as well as others that are associated with telemedicine.
We've seen wonderful patient interactions where the actual care nurse is there, the family is able to come. They have the questions about patient care that they don't typically get answered. It also takes away the struggle that some providers have of asking you to come every week for a visit. North Dakota NICE makes it so that I hate to ask you to come, although I know as a provider that I would probably be better off advancing your care, looking at your care plan every week.
Working in a rural atmosphere, which we are in this area, it gets to be burdensome. And the role of telemedicine is to hopefully decrease some of that burden on the patients and their families, and taking away that travel time, taking away that full day that needs to be consumed for a visit. And to take care of patients appropriately, especially in the midst of changing medications to try and establish a better outcome, those frequent visits are necessary. And no longer, with telemedicine, no longer do we need to make a decision between really burdening the family and not seeing them.
I really think if there's a role model to look at. It's what we have right here with our partnerships, and it's more than telemedicine. We work together in many different areas, from the clinic to the ancillary services, lab, and imaging. We have many, many arrangements, and I think the best part is we're cooperating. We're very conservative in the use of our healthcare resources in this region. It's recognized by employers and community members for our efforts to be as fiscally responsible as we can, and yet provide the appropriate services to the people of the region. So we just have a great relationship with Altru, and I think it really is a model that could be used elsewhere.
Telemedicine services will expand, especially in 2009, with the services of neurology, dermatology. I see cardiac services being very eminent in being provided through telemedicine.
I think telemed will increase the patient load up in Roseau, because it's all about access, and when people, Roseau's, I mean, far away from any other major cancer center, so definitely if they can be seen closer to home, they're going to prefer to be seen closer to home. And then
the future of telemedicine in neurology is wide open, is great. With the stroke initiatives, particularly the emergency room treatment of patients suffering from stroke, gets to be very important, and with the concept that time is brain, and the sooner that we can get appropriate treatment and appropriate evaluation and treatment to stroke patients in our rural hospitals is key. And I see telemedicine and expanding telemedicine to be playing a big role in improving treatment of stroke patients out in our rural hospitals.